Now coming to the medical management. The medical management, now you know, means we are giving some drug. Okay, expectant means you are not doing anything, you're just waiting and watching, and I've told you the criteria. In the medical management, the drug of choice is methotrexate, which is an anti-cancer drug. Now the dose can be calculated either with the weight of the patient, that is 1 milligram per kg body weight, so it comes to roughly 50 to 60 milligram, that is a normal weight of the patient. And if it has to be done with the meter square body surface, then it is 50 milligram per meter square body surface area, administered IM as a single dose. Remember this, it is a single dose. Okay. Now, what is the criteria for medical management? You can see how the expectant and medical management, they differ. Now, absolute requirements will be hemodynamic stability, which is very, very important for both expectant and conservative medical management. No evidence of intra-abdominal bleeding, again same for them, both of them. No contraindication to treatment, means you should not be contraindicated towards methotrexate. Okay, so the methotrexate is an anti-cancer drug. It has its own toxicity. You will read this in medicine also, so you know what are the side effects of methotrexate. I will also tell you. So the patient should not have any contraindication for methotrexate. Okay, then beta HCG should be less than 5,000. There it was how much? There it was less than 200. 1500 according to your textbooks and 200 according to ACOG. Now, tubal diameter here should be less than 4 centimeter with no fetal heart. Not the tubal diameter, actually it is the gestational sac diameter. Okay, here the gestational sac diameter was less than 3 centimeter with no cardiac activity. Here they are saying it should be less than 4 centimeter with no cardiac activity. But in the preferable requirements, they have allowed a cardiac activity if the size is less than 3.5 centimeter. So that is a gray zone now. Less than 3 centimeter with no heartbeat is expectant. Less than 4 centimeter with no heartbeat is medical. But less than 3.5 with heartbeat can be taken up for medical. So less than 3 centimeter with no heartbeat is expectant. Less than 4 centimeter with no heartbeat is medical. Okay, understood? But less than 3.5 with heartbeat will not go towards expectant, it will go towards medical management, that is methotrexate. So if heartbeat is there, you cannot think of expectant, you have to go for medical management. Okay, understood? Now, beta HCG 1500, 200 in expectant, and here it is 3000. Right? Absent cardiac activity, yes. Mild pain or absent pain. So the most important confusing part is this, the tubal size. Okay, that is this one. That the fetal heart is present and the size is less than 3.5, you can still go for methotrexate. These will be some confusing MCQs. There will be some confusing MCQs where these criteria will be used. That is why I am telling you. So less than 3.5 with fetal heart, you can still go for methotrexate. Again and again I am telling you. Tubal diameter less than 4, no heartbeat, go for medical management. Beta HCG less than 3000, go for medical management. Okay. But here it is saying that absolute is less than 5,000, beta HCG preferable is less than 3,000, because different textbooks are telling you differently. So if it is less than 3,000, you can be dead sure that yes, you can go for methotrexate. If it is between 3,000 to 5,000, then there is a gray zone. Then it depends upon the patient's other conditions. Okay. Now, what are the contraindications for methotrexate? Sensitivity. Intrauterine pregnancy, obviously you will not give methotrexate, especially if it is a heterotropic pregnancy. You just want to get rid of the ectopic mass, not the intrauterine pregnancy. So if it is a double pregnancy, you cannot give methotrexate. Tubal rupture. If it's a tubal rupture, yes, you can't do. Peptic ulcer disease is obviously a disease where methotrexate is contraindicated and the patient is breastfeeding. If he's breastfeeding, then you cannot give methotrexate because it can harm the baby. So these two are the contraindications for methotrexate, which I just told you that these are the prerequisites, that she should not have any contraindication. What else? Active pulmonary disease, immunodeficiency, hepatic, renal or hematologic dysfunction. That is again something that you will read in medicine and pharmacology, the side effects of methotrexate. So the lungs should be good, the liver, the kidneys, the hematological dysfunction should not be there, immunodeficiency should not be there, and most common side effect is liver involvement. So that is why they want a proper hepatic health. That is, the liver should be absolutely fine before we give methotrexate. Okay, understood? Now coming to the procedure of medical management, it is very, very important. Day 1, day 2, day 4 and day 7, what do you do? Day 1, you measure her beta HCG. You take a TLC and DLC, that is you do a CBC. You do her HB test, you do her liver function test and renal function test. Okay, so you have done RFT, you have done LFT. and you've done a beta HCG to check what was the baseline beta HCG before you give her methotrexate. Day 2, you are giving her a single dose of methotrexate, which was 50 milligram IM. Okay. Then day 4, after a gap of 1 day, you do a beta HCG and the counts are repeated. So you do a CBC again. Okay. So you're doing CBC here, you're doing CBC here, you're doing a beta HCG on day 1 and you're doing it on day 4 also. Okay. Day 7 again you do a beta HCG. So you're doing beta HCG on day 2, day 4 and day 7, right? And counts are then repeated again. So this is how you manage the patient. CBC repeated on day 1, then day 4 and day 7. Beta HCG on day 1, day 4 and day 7. Okay. So every time you're doing beta HCG and CBC together. Now check for the decline in beta HCG between day 4 and day 7. Day 4 and day 7 is the main dictum where the questions will come. So day 4, they may be slightly increased, they may be slightly decreased, they may be more than 15% decrease, they may be more than 15% increase. So everything is very confusing. Just go with the flow, think and use your brains and you will understand. Okay. So day 4 to day 7, you are checking the beta HCG. Day 2, you check the baseline beta HCG. Day 1, sorry. Day 1, you did a baseline beta HCG. Day 4 and day 7, you are checking how is the response to methotrexate given on day 2. So what happens when there is a more than 15% decrease on day 4? Day 4 is showing a more than 15% decrease. That means it is a successful medical management. Don't do anything. Just do weekly beta HCG and tell her that, reassure her that it is working. The medical management is successful. Okay. Weekly beta HCG is done, nothing else. Now what happens if the decrease is less than 15%? It was more than 15% initially, that is a successful management. Now, the decrease is less than 15%, that means she needs another dose of methotrexate. That means that was not enough. It is decreasing, it is resolving, but it is less than 15%. Okay. So now you have to, or the cardiac activity has appeared. Cardiac activity was not there initially, but now it is showing. So that means beta HCG is decreasing, but now because the gestation has increased slightly 3-4 days ahead from what you did initially, you did a TVS on day 1. Now day 4, you can see the cardiac activity, but still the beta HCG is coming down. That means your medicine is working, but it is not optimum. You need to repeat it. So what will you do now? Repeat methotrexate injection. Give it again on day 7. Not on day 4, not on the day you checked. Okay. You give it on day 7 and consider this as day 1. Treat it as day 1. Day 1 or day 2, just like we did here. We started methotrexate from day 2. So consider it as the first day of your next cycle. Okay. Then what you do? Then you can give maximum how many doses? Because next time, again after day 4, if you are checking methotrexate, again it is a less than 15% decrease. Can you give methotrexate again? Yes. You can give maximum 3 injections of methotrexate. Right? Now, even after 3 injections, if it is not decreasing, not optimally decreasing what we want, more than 15%, then it is a failed management. Okay? It is failed. That is known as a failed medical management and you go for surgery. Okay, that is the only thing that you do here. Now, what happens if there was a slight increase in beta HCG? Will you think that it was a failed management? No. If there is a slight decrease on day 4, that is quite normal. Why? Because there is a shrinkage of the sac. So, you are basically giving her beta HCG to shrink the sac. So, the sac is crying and it is releasing some beta HCG. So, shrinkage of the gestational sac can give little increase of beta HCG on day 4. So, you have to repeat beta HCG on day 7, still increasing, then it is a failed management. Okay. Now, if it is decreasing, but it is less than 15% decrease, then you go here. Okay. Give her maximum 3 doses. But if the result is not coming, then again it is a failed management. If it is more than 15% decrease, that is good. It is a successful management. Right? Understood? So there can be 3 possibilities. It is successful, so there will be more than 15% decrease. It is less successful, but it is going towards success. So it will be less than 15% decrease. You repeat the injection and you can do up to maximum 3. Or there can be slight increase up to day 4. But between day 4 to day 7, there will be no increase. There shouldn't be any increase. So day 4 to day 7, there should be no increase. Okay? If it is still increasing, that means it is a failed management. That was what I told you here. Okay, so you repeat, if it is not decreasing, it is still increasing, it is a failed management. Less than 15%, then you again go back to the same treatment. More than 15% decrease, you go back to the successful treatment. Okay, so this is how you manage with methotrexate. Now, what are the variable doses of methotrexate that we can use? 1 milligram per kg IM, as I told you. So it can either be given as a single dose of 50 milligram per meter square of body surface area, or 1 milligram per kg IM, and it can be given as a multiple dose instead of single dose. Day 1, day 3, day 5, day 7, and you give leucovorin with it. Leucovorin to counteract the side effects of methotrexate. It is given alternately day 2, day 4, day 6, day 8. So 1 to 8 you are giving 1, 3, 5, 7 methotrexate, 2, 4, 6, 8 you are giving leucovorin, and the dose is 1.1 milligram per kg IM. Serum beta HCG should be measured weekly until it is less than 5, just like we did in the single dose of methotrexate. Okay. Coming to the precautions during therapy. What are the precautions we need? Now, as I told you in the previous slide, we have to avoid pervaginal examination because theoretically, you may rupture the pregnancy or you may dislodge the clot which is already there. The body has already clotted that ruptured pregnancy and it is not bleeding. That fibrin has actually just stopped the bleeding, but you may theoretically disturb it. You may theoretically disturb it or cause rupture. Okay, so pervaginal examination has to be done cautiously. Avoid sun exposure because methotrexate itself can give dermatitis. So methotrexate patients who are getting methotrexate, they should avoid sun exposure. Avoid vitamins containing folic acid. They may antagonize methotrexate. Avoid intercourse or new conception. Obviously, when the patient is on methotrexate, why will she conceive or why? You have to just tell her to avoid intercourse because we don't want any more new conceptions in the time period when she's on methotrexate. Plus, avoid NSAIDs. Why NSAIDs? Because they interact with methotrexate. They decrease its renal excretion, which will lead to toxicity. So basically, the renal system has to be good. The liver has to be good when the patient is getting methotrexate. So if they are not healthy, then they will not excrete methotrexate. The metabolism will be poor and that will lead to toxicity. So NSAIDs should be avoided. Next, coming to the pain after treatment with methotrexate. The pain after treatment is mild to moderate pain or severe pain. Mild to moderate pain, you can give acetaminophen. Acetaminophen is simply paracetamol. Cause may be tubal abortion. It is causing tubal abortion, or it is causing tubal distension because it is kind of just squeezing the tube because the gestation sac is inside. Means medical management is working. So tube will first distend, it will release a lot of beta HCG and then it will get destroyed, right? The pregnancy will get destroyed. Severe pain might need a TVS and monitoring of vitals as to why it is happening, because if it is aborting or if it is causing rupture, in that case, it might be a problem. Although methotrexate will not cause rupture, but if it is a severe pain, you have to monitor as to what is happening, okay?